Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Marjolins ulcer. So the Marjolins ulcer, it is nothing but a low-grade squamous cell carcinoma. It is a low-grade squamous cell carcinoma. So you're writing it as SSC. So low-grade squamous cell carcinoma, SCC. So it arises from four structures. That is a long-standing. So it may be from the long-standing ulcers. So long-standing ulcers like the venous ulcer. So long-standing ulcers like the venous ulcers. Then it can also be due to the post-burn scar. So they can be post-burn scars. Then in terms of the chronic osteomyelitis. So it is seen in terms of the chronic osteomyelitis as well. Next, in terms of the post-radiation scar. So Marjolins also, there was a low-grade squamous cell carcinomas we saw. Then there is a slow growing. It is slow growing, since it is relatively avascular. So it is slow growing since it is avascular. So it is relatively avascular, so it is slow growing. Next is, it is painless. So painless is due to the absence of nerves. So painless due to the absence of nerves. Because of this, it remains painless. So it is painless due to the absence of nerves in the scar tissue. Then we look at, there is no secondary deposits. Next is, there is no secondary. So there is no secondary deposits. So no secondary deposits, since there are no lymphatics in the scar tissue. So there are basically no lymphatics, and this is in the scar tissue. And it is radio-resistant. So radio-resistant, we write it as RR. So it is radio-resistant to the avascularity. So it is resistant, radio-resistant to the avascularity. To learn and grow daily like this, please do subscribe.